Now, welcome back. It's the middle of summer, but many parents are working on those back-to-school checklists. And one of the most important things, making sure your kids get their shots. And Dr. Connie Gistan with Louisiana Department of Health and Hospitals joins me now. And Connie, you all are...
Good morning.
Good morning. How are you? Thanks for being in this morning. The policy is no shots, no school. It's the law. How hard is this policy going to be enforced?
Well, it is the state law, and schools are pretty strict in enforcing that and making sure that children have their vaccines, and it's very important. Immunizations are one of the greatest achievements of the 20th century. In fact, vaccines are largely responsible for the control and the eradication of lots of different infectious diseases that used to plague our country in high numbers, such as polio, diphtheria, measles, and mumps. Now, these germs that cause these infections still exist, and they're still out there, but vaccines largely decrease their existence, and it's very important that parents get their children vaccinated.
What are the rules these days? Which vaccinations do children need to get?
Well, it depends upon the age of the child, and it can be quite complicated. So one of the things that we ask parents to do is follow up with their local primary care provider, their children's pediatrician, or their family doctor to get the right vaccine for the right child at the right age.
Most important at the younger ages, kids going into elementary school, what are the required vaccines for a first grader?
Sure. So going into elementary school, if children are 4 years old and older, they need at least 2 shots of the varicella vaccine. They need to be up to date with the polio vaccine and measles, mumps, and rubella too as well. And then one important thing for our junior high children, in addition to the regularly scheduled childhood vaccines, they need to also have the meningococcal vaccine, and that's a vaccine that protects against meningitis.
Are there any ages where students aren't required to get vaccinations? Are they still required in high school or at the college level?
Well, at the high school level and at the college level, if they haven't had their meningitis vaccine, they may want to get that. But actually, vaccines start from birth, from infancy, when we begin the hepatitis vaccine on our newborns, all the way into our 80s and 90s when we are getting influenza vaccines and the like. So vaccines are an important part of public health and community health, and so we start these vaccines in infancy, and actually they continue throughout life. But we want to definitely be able to emphasize to parents to get their children vaccinated, because when we don't vaccinate our children, that opens the door for the emergence of these diseases that we once had very high levels for in this country.
So much emphasis over the H1N1 virus a couple of years ago. Are those vaccinations required?
Well, the H1N1 vaccine will now be part of the new flu vaccine for this upcoming year. And so for parents who are getting their children vaccinated for the flu shot, the H1N1 vaccine will be included in that, so they will have that coverage.
Part of the standard flu vaccine.
Exactly, it's part of the standard flu vaccine.
And Doctor, every year it seems like we're shocked to hear of a meningitis death on one of our college campuses, but that vaccination is still optional.
Yes, and actually it is still optional. I don't think a lot of colleges actually require it, but it is highly encouraged that students do get the meningitis vaccine.
No shots, no school, it's the law. It's time for parents to sort of pay attention to what shots they need to get.
Absolutely, and one quick thing I just want to say is that vaccines are available at all of our health units throughout the state, at some of the federally qualified health centers, and again, parents should touch base with their children's primary care physician or their family physician to get their children vaccinated.
Thank you, Doctor. Appreciate it.
You're more than welcome.
And coming up